Ramadan Mubarak and welcome to the second edition of Majlis. You know that saying where it says health is wealth, but how far do you go to take care of it? Let's find out tonight. Just join me in welcoming our next guest, Dr. Narayan Ramachandran.
Good evening, doctor. Thank you for being here with us. It's a pleasure to have you. Uh, it's a very interesting chat that you were having before you're talking about your background. So tell us about your military background. Tell us what led you to this path in your career and how you became an orthopedic doctor. Tell us about your journey.
So I grew up in the city of Bombay. I still know it as Bombay. And I did my schooling, my medical education, my postgraduate education, and I was working as a lecturer in the University of Bombay. When an opportunity came by, when the Director of Medical Services from the Royal Army of Oman visited Bombay, and I met with him through my professor, and he was very keen that I join up. I was not very keen at that time because I had a good academic career going. But you can never plan. It's always, I believe it's always predestined. So I was destined to come to Oman. At first, I was not exactly aware where I'm going. So I came in July 88 to the Armed Forces Hospital. I stayed with the Armed Forces Hospital for nearly 33 years in service before I retired as a full colonel. I've had an eventful and a very satisfying career here in this beautiful country, and I was fortunate that this country adopted me as one of their own almost about 15 years back, and I got the Omani citizenship. In fact, I was one of the first from the armed forces to get the Omani nationality, thanks to the late His Majesty Sultan Qaboos bin Said. And it was a privilege to wear the uniform of His Majesty the Sultan's Armed Forces for such a long time, and at the same time be recognized for your efforts and be decorated with some of the highest honors that the military gave in our days. And as I always say, for 33 years I served this beautiful country in uniform. I continue to serve the people of Oman without uniform in my civilian attire.
Yeah, that's a beautiful journey you've had. Over 3 decades of your experience. So how has that shaped your thought process about orthopedic care, and what are the changes you have seen over the years here in Oman?
It has been a dramatic change over the years. A lot of it, which we used to face in the initial days, was multiple road traffic accidents. In the earlier days, we only had a single carriageway going from Muscat to Dakhliya and Muscat to Batana, Muscat to Sharqiya, and the Armed Forces Hospital was at the mouth of all these main connectivity roads, and we would get multiple casualty incidents. That has changed with the change in the infrastructure, and the number of casualties, high velocity casualties, have decreased. Facilities have improved over the years. Earlier, a lot of people were general orthopedic surgeons and trauma surgeons. Over the years, specialty training has come even into orthopedic programs. We've been fortunate that Oman has its own postgraduate training programs in almost all the specialties. I was lucky to be a part of the orthopedic residency program since the time of its inception in 2010-2011. And now we have excellent young people whom we have trained and who are now taking responsibility in various hospitals. The generation immediately after me, a lot of them studied at the Sultan Qaboos University and went abroad for their specialty training in orthopedics. They then went through rigorous training as anybody would do in the Western countries. They were not privileged at all. They had to go through the rigmarole. They had to do everything that was expected of a resident in Western countries. They came out well hardened, well trained. They all chose subspecialty trainings. So now, at least at my hospital, you have people who do exclusively sports medicine. Some people do joint replacements. Some people do hand and upper extremity. Some people do exclusively spine. The Armed Forces Hospital also was very fortunate to have the first orthopedic oncology, trained surgeon. He trained in Malaysia, and now that's the trend. The university, 3 main hospitals in Muscat, the Khawla Hospital, the Sultan Qaboos University Hospital, and the Armed Forces Hospital, or the what is now known as the Medical City for Military and Security Services, has all the specialities and subspecialties, which is on par with any country in the world. Right. And I must say that our doctors are also well experienced, and I always told my trainees that your training is a reflection of who is training you. Mm-hmm. And today I can confidently say that if I need anything to be done to my body, I will go to one of the students whom I have trained. Yeah. And they've turned out to be brilliant young doctors.
So you have seen n number of patients in your career, and you continue to do so. Tell us one of the most, impactful moments in your career, maybe a patient or a story or an example that you have that you still carry on with you in this day.
There have been many such incidences. My family calls me a sentimental fool. I do tend to get a little bit emotionally attached to my patients. This was told on my very first day of postgraduate training: never get emotionally attached to your patients, but that's an individual personality. I've treated many. One I do remember is a gentleman from Ibri who unfortunately had an accident and broke his thigh bone in multiple places. Had surgeries at 2 other hospitals which didn't give him a satisfactory result. He had very bad infection. The plates which were there inside were infected, and he was pouring pus, and he was miserable. So he came over to our hospital, and then we had a long discussion, him, his family members, and they all understood that treatment is not something that is overnight. We don't work magic. We do our best. And doctors treat, God heals. So we told him that he has to be patient. It's going to take multiple surgeries, but eventually we will get there. So we worked together. The patient understood everything. His family members understood everything. He was smiling every morning. We saw him on rounds. And eventually, over a period of 6 to 9 months, with multiple surgeries, experimental treatments, he healed, started walking, albeit with a short limb, is happy. He messages me on a regular basis. I visited him in his home in Ibri, visited his mother and his family people, and that was really rewarding. So it's essential that we as doctors also have a sense of empathy towards our patients. It's not just, a patient is not an arm or a leg or an eye, and this is what I teach my students. They are living human beings with a heart and soul, and we need to look at them in that way.
Actually, that's a beautiful point. I was just getting to the segue where I want you to tell me the balance that a doctor should have emotionally and very technically. Like, you should not be very emotional, but at the same time have a technical hold of your expertise. Coming back to that, I would want to talk about you're a knee expert, right? So what are the most common mistakes athletes make this day that leads them to injuries in different kinds of sports?
Okay, everybody wants to be fit and play. One of the most common things in Oman is, of course, football. And football is played on all kinds of surfaces, not just on a proper grass court. Anywhere you find a pitch, you erect 2 shoes or stones, and that becomes your football ground. Yeah. People don't warm up properly, and post-play don't cool down. Some people tend to play rough, so that does affect them. Minor injuries are neglected often till they become troublesome. Repetitive injuries are neglected because, a couple of days rest and you can get back to play with small niggles. By the time young 25 and 30-year-olds come to us with knee ligament injuries, their knees are as bad as 50-year-old people. So it's important that at the first sign of an injury, you you consult an expert. Now you have experts in all government and private sectors. Get an opinion, follow the treatment that is recommended, and all you need is to have a period of rest, a period of exercise, a period of rehabilitation, and where it demands, you need to undergo the surgery, and surgery is standard throughout the globe. Everything is prescribed for each particular type of injury, and therefore one can really get back to what they are doing without any issues.
Yeah, you mentioned surgery, and it's become like a stigma for a lot of people. The moment they hear surgery, they get scared. What do you think Oman is doing differently from a technical aspect that aids that process? It makes it very simple for recovery. What do you think is unique about Oman from that perspective?
The beauty is now in Oman, a lot of the senior doctors, senior consultants are of Omani origin. So that connect is there between the patient and the doctor. The doctor understands what the patient's needs are, is able to communicate in a language that they can understand. Oman now has cutting edge technology. We have everything that is available. In fact, a few years back, about 5 years back, the Armed Forces Hospital performed the first 3D knee replacement as well. We have minimally invasive spinal surgery. We have endoscopic spinal surgery. Robotics is now coming in. So a lot of these cutting edge technologies is available, and all surgeries where possible is minimally invasive. So recovery is much faster than it was in the earlier days. Right. After a spine surgery, 10 years back, people had to be in bed for a few weeks, then rest for 3 months. Now with cutting edge technology, same evening, next morning, you're out of hospital and you're walking, and in a week's time, you're back to work.
Yeah. One technical thing that's been going on during the waves and social media is shockwave therapy when it comes to recovery. Can you break that down for us in simple manners, in a way we can understand what that is and how it can help athletes?
So shockwave therapy is something that we brought into Oman. In fact, I was one of the pioneers almost 25 years back, and I read about it on a BBC news program where they were treating non-healing fractures with shockwave therapy. So I approached our urology head of department in those days and spoke about this idea with articles, newspaper articles and other articles from the net, and he was quite supportive. So we started doing it. And now it is so evolved, and I had an opportunity to go to Germany to learn about it and see it practically being used for orthopedic conditions. So now it is mainly used for soft tissue conditions like tennis elbow, heel pain, or what we call as plantar fasciitis, sports related trauma. We also treat fractures which are not healing, long bone fractures, small bone fractures, everything. So what it does is that it provides, not unlike the kidney stone breaking where you need high intensity shock waves, here the shock waves are of lower intensity. So repetitive shock waves breaks down the tissue, promotes what we call as the establishment of new blood supply, which tends to heal, which also tends to take away the pain causing metabolites in that area, and leads to fairly successful outcomes in 80 to 90% of cases.
Right. A lot of people, they are, especially of my age or younger than me, have a lot of knee pain or back pain because of the lifestyle that we lead. So, and many people have arthritis, they just don't know it in different stages. What are some lifestyle changes you recommend young people or even those who are older so that they can, delay that process? They might not be able to avoid it sometimes, but how do you delay that?
See, just like our hair turns gray, everything in the human body has physiological changes. You cannot avoid it. But as you say, you can do something to delay the onset of such issues. I know people who've lived into their 90s with absolutely no issues. The key mantra for this is to eat healthy and keep fit and active. It's important that you stay active. Do not stop doing what you have been accustomed to doing. Eat healthy. Eat what you like, but eat it in the proper proportion. Eat the right macronutrients so that you have a well balanced diet, and at the same time exercise adequately as per your, listen to your body. Whatever your body permits you to do, do it. People I see every morning people walking, people running, exercising, the gyms are full. So everybody is active and they're paying good heed to their individual health. It's important that you stay fit, active, and listen to your body. That's most important.
Yeah, that's true. So looking at the technology ahead, say in the next 5 years or 10 years, what do you think is something that excites you still in this age here in Oman that you look forward to?
What I am looking forward to is, one, the artificial intelligence is coming in a big way into healthcare, which helps us not only just look at data in a larger sector, it also helps us to plan treatment algorithms. It helps us to study subsects and do more advanced technological treatment for them. That's something that is very interesting and is into the medical sector. Artificial intelligence, ChatGPT, robotics, all that will not still replace human intelligence, human endeavor, and the involvement of expertise from the human side, because it's us who think. The machine doesn't think. The machine just performs what it is told to perform. So it is we as physicians who need to be technologically abreast with what is going on, and that's something that happens in Oman. Oman is lucky to have medical societies of all these specialities. We have regular meetings, seminars, updates, and since one of the positive outcomes of the COVID pandemic has been distance learning, and that is in a big way influencing everybody. Sitting here, I can listen to seminars in other parts of the world. Even if not live, I can see recorded versions and learn from them. That's something beautiful.
You mentioned about the rehabilitation process. It differs with patients. But those who are having a longer rehabilitation process, mentally they are in a very tricky situation. So from that perspective, how do you aid them? What is one advice you would like to give to those who are having a longer rehabilitation process?
Okay. So, it's easy for you and me to sit here and talk about it, but the person who's undergoing it is the one feeling it. Yeah. I can tell them be positive. I can tell them, mindfulness is an important thing, mental resilience is an important thing. But as healthcare professionals, it's important that we understand the patient's perspective. Any treatment that is there, rehabilitation, is a journey that we walk together. And the patient walks alongside, understands the goal that they have. Once you set a goal and you break it up into realistic small steps and tell them that, that's how we achieve it. 1 week, 3 weeks, 4 weeks, 12 weeks, and encourage them that yes, you have achieved this particular goal. Have a chart or have your own calendar where you mark your progress. Makes a lot of difference. And at the same time, reinforcing them with positivity, getting their family members involved, at least one family member or a close friend who walks the journey with them, definitely makes a difference. It is a painful process, but at the end of the day, if both understand each other well, it will be a satisfactory outcome.
You're deeply involved in surgical coaching. So from all the trainees that you have trained in the past or you're currently training, what is the one valuable lesson you impart to them from a technical perspective and from a human perspective?
As a coach, it's my responsibility to help them discover their inner potential. All of us are like the oysters in the sea. A speck of sand gets in. The oyster doesn't know what to do. It just works on it. Tears come out, it works on it, and one fine day that speck of sand comes out as a beautiful pearl. All of us have that pearl within us. It is for us or someone to help them realize this, realize their innate potential and come through. One important point that I have to make today, today is International Women's Day, and I'm very proud to say that historically orthopedics is considered as a male-dominated profession. In Oman also it has been that way, but gradually that has changed. Oman today has almost 31% female residents as against the international average of 18%. And I'm very proud to say that a very wonderful, healthy and safe environment has been created for training where nobody feels discriminated. Each person is treated equally and everybody gets the same opportunity as their counterpart. And at the end of the day, you see stars coming out. We now have 3 lady consultants, one at the university, one at Khawla Hospital, and one in Salalah at the Sultan Qaboos Hospital. And I'm very proud they've all been my mentees who have turned out excellent. And now we have a whole load of them. In fact, tomorrow I'm meeting with the 2 of my young female trainees who are in Bombay doing their oncology rotation at Tata Memorial. And I'm going to be meeting with them for dinner and to learn about their experiences. So even though I may not be in active service, I still do continue to coach and mentor them. And not just in Oman, I've been fortunate to be approached by countries like Nepal, Ethiopia to coach and mentor their postgraduate students as well. So that's something that is, for me, giving back to my profession, giving back to society of all the experience that I have gained over the years.
It's a beautiful thing to think about and ponder on. So before I let you go, I'm sure everyone asks their doctor, the home doctor or their consultant, what is the one tip they follow that keeps them healthy? So I want to retain that question back to you. What do you do to keep yourself healthy, your joints and bones healthy?
Thank you for asking that question. At this point, I would like to acknowledge today, especially again, the role of my wife. She has also been a doctor and a professional gynecologist at the Khawla Hospital for many years. She has been responsible for me being more aware of my own health. So however late the evening or whatever it is, we are out at Kurum Beach at 5:36 in the morning for our 5K walk. We are back home, we eat healthy, we exercise on a regular basis. I do yoga 90 minutes 3 days a week, which keeps me well balanced. Yoga is not exercise, it's for my growth, my spiritual benefit. And I also exercise with a trainer twice a week. So it's important that you stay healthy, find time for yourself. We may have time for everything in the world, socializing, otherwise it's important that we make time for our own health. I also would like to say this to the younger generation. As a young orthopedic surgeon, I enjoyed working 24 hours a day, non-stop. It was a challenge. I don't want anybody to pay the price for neglecting their health in their younger days. So care of your own self begins on day one. You don't have to wait till you're 60 to start doing it. You can do it even when you're much younger.
Perfect. That's the best way to wrap up the interview. And to all the women out there, we want to thank you for inspiring us, like you mentioned. Thank you, sir, for being here.
My pleasure, Paul, and thank you, the Arabian Stories, and my dear friend Nishad for having me this evening, and lovely talking to you.
Thank you so much. For more content on Majlis, keep following TAS.